Hello everyone, I am Wadi Skaf from Eidvoslorand University, and today I'm doing the presentation for our paper, which is Towards Automatic Forecasting, Evaluation of Time Series Forecasting Models for Chickenpox Cases Estimation in Hungary. AI has been widely used in medical applications, and its importance has grown as a result of its ability to identify diseases, predict them, and even prevent them. Predicting the number of cases of a disease such as chickenpox enables the health system and necessary medications to be prepared. There is a domain in AI applications which is called the time series forecasting, which is the process of predicting the value of future observations of a time series based on historical data. Given that the reported chickenpox cases form a time series of values, studies can be conducted to predict the number of future cases. For this research, our dataset consists of county-level time series depicting the number of chickenpox cases reported by general practitioners in Hungary from 2005 to 2015. Our contributions are: first, we conducted a comprehensive exploratory data analysis on this relatively new dataset in order to identify underlying patterns. This included examining the relationship between chickenpox cases and other variables, such as the population. Second, we conducted comprehensive experiments on multiple time series forecasting models and selected the models that produce the best results for each county and at the national level. As I mentioned, we conducted comprehensive experiments, and for that we used 20% of the data for testing. And for data normalization, we tested two methods. The first is to scale the data to be in the range -1 to 1. The other is to make the data as a percentage of the population at the time the cases were reported. And as a loss function, we used RMSE. And for the models, we tested on the following: ARIMA, SARIMA, SARIMAX, MBITS, DPR, LSTM, GRU, and TFT. And as for the results, we found that the LSTM model performs better than any other model in the vast majority of the time series of the counties. The main reason the LSTM model outperformed other models was due to the LSTM ability to do long-term memorization more than the other models. And as can be seen in this figure, the vast majority of the series does not have a consistent pattern and would therefore benefit from this long-term memorization. This also explains why SARIMAX performed better on the country level series, where all series were summed, resulting in a more consistent pattern that does not rely heavily on long-term memorization ability, as we can see in this figure. We also found that our method of data pre-processing improved every model with an average improvement of 51.39% across all the models. And for our future work, as can be noted from the title of this paper, the plan is to automate the time series forecasting. Therefore, we plan to expand our work and implement a framework that can automate the data pre-processing, automate the model selection, and automate the hyperparameters tuning. Thank you everyone for listening and for your attention. If you have any questions, feel free to ask me now or send them to me on this email address.